Was Tuesday Health. We discuss all health matters, and coronary angiography is a procedure that uses a special dye and x-rays to see how blood flows through the arteries in your heart. Producer Martha Nilonga sat down with radiologist at the Ongwediva Medipark, that's Dr. Precious Champiti, to talk about this very procedure. Let's take a look.
Good morning. My name is Dr. Precious Champiti. I'm a diagnostic radiologist. I'm working under Ongwediva Medipark Radiology. Coronary angiography, as the name implies, coronary are arteries that supply the heart. These are critical because they are supposed to always be at their best to ensure that our hearts are working. The study that is angiography is the study of blood vessels, in this case, the coronary arteries. Why is that? Is because it is used to diagnose several conditions that affect these arteries and which ultimately affect the heart itself. So the method is there where you are able to put tubes through the blood vessels, either through the arm or through the thigh, and extend them all the way into the heart, and are able to take pictures which are visualized on screens, and one is able to plot the course of these arteries and to see where the abnormalities are. What are the conditions that this medical procedure is actually used for? So there are several, but the main ones include chest pain, which is central, which one notices is sudden, continuous, and one is not able to really do much else. So if it happens at night, one is not able to sleep. If it happens during the day, one is not able to carry out activities. Another condition is called angina, where you just have, again, pain, but it's central, and it is localized to that area of the heart, whether it's on the left or right. The other problems are fat clogging the blood vessels. The other problem are blood pressure related changes, and as well as heart attack, stroke. So those are the main ones that this particular medical procedure is used to diagnose and to treat, because it is both a method for picking up the abnormality, and in the same way we are able to intervene, meaning that we're able to heal whatever it is that has been affecting that particular part of the heart. Yes. In our vicinity, meaning Namibia, we have several centers. First of all, in the north, we are the only ones. So Ongwediva Medipark, we have a cath lab. This is where this procedure is actually done. And we have several cardiologists led by Dr. Chiweza, who's our resident cardiologist. We also have visiting cardiologists, who come from time to time and are regular. So we are very well covered. Other centers in Namibia include in Windhoek, as well as in the coast in Swakopmund. So we are quite blessed as a country to have these particular centers and to have personnel that actually is there. So in any of these locations, we are always likely to get help if one has any of these conditions. Sometimes people may not be conducive for this particular procedure. Such people may have pre-existing conditions such as clotting disorders, so you bleed a lot. Some people may have allergies to the chemical that we used to visualize the vessels. Other people may have other predisposing illnesses which may not be conducive to it, such as a very high blood pressure or a very low platelet counts, meaning that the clotting factors are not exactly working. So we also have to have alternatives to it. And these include what is known as cardiac CT. This is where we are able to check what kind of calcium is in the blood vessels. Why is that important? Calcium it predisposes to a whole lot of conditions, such as the heart attack we're talking about, such as the angina we're talking about, such as chest pain, because it actually blocks the blood vessels. It also helps to indicate that the person has got a blood pressure problem or other major systemic illnesses that we can think of. The major one, though, is called a cardiac MRI. So this is a study of the heart using the machine that is right behind us, the MRI machine. So this one checks the heart in real time. It's able to denote the muscles, the valves, the surrounding tissue in actual real time, and as well as the blood vessel itself. So it is the major alternative to a coronary angiogram. If not in the near future, it will replace it. But those are the alternatives that we actually have at the moment. This is an MRI machine. It's a machine that uses both magnets as well as radio frequencies to image patients' parts of the body. So you can image from the head to the toe, and each one of them is done in a very different way with very different sequences. We call them sequences because we are using radio waves and magnets. It is highly sensitive because of the magnetism. So we're always saying everybody who's going in there must not have any metallic products. So watches, necklaces, earrings, even implants. But because we have improved from the previous models to the current ones, there are actually ways and means of having to protect those medical implants that people may have. So the heart pacemakers, the nails that people are given after they have broken bones, joint replacement. So those people are now able to come and be diagnosed on the machine if it is actually needed for them. It's a very smooth and a very agile machine because we're able to see a whole lot more than many other imaging procedures that we actually do know. Hence why we were mentioning something about the cardiac MRI, which we see in the near future replacing the coronary angiogram, as it is one not invasive. So what happens when a patient has had the coronary angiogram? Normally, it is a 3 to 4 hour procedure followed by a rest, and it normally takes a day or two for our clients after the procedure, and then we discharge them. When they go home, they don't automatically start back to their functions because sometimes other people are a bit slow to recover. So we're looking at time between 4 days to 2 weeks. But in that period of time, they're still able to maintain their level of life. And if not, they'll start seeing improvements either immediately, either in the short term, or even in the long term. But most times, in more than 70 to 80% of our clients, there is remarkable recovery and they do see a change in their health. That, in short, is what happens